Hello everyone, I'm Dr. Shakil Akhtar, Associate Professor, Department of Nephrology, Institute of Child Health. Today I'll be speaking about urinary tract infections in children. Urinary tract infections, or UTI, what we say, are one of the most common infections in children. And beyond infancy, slightly a female has more preponderance for urinary tract infections because of the anatomical reasons. But overall, if you look at these infections are sometimes very common. Urinary tract infections can occur at any age group, right from the neonatal period to even adulthood. But what we need to understand in children, the symptoms and signs can be very varied. So if you have children with urinary tract infections early on during early neonatal period or in early infancy, the symptoms can be very challenging to pick up. They can present like any other sepsis, like fever, poor feeding, lethargic, vomiting, and those things. But in slightly older children, they are able to at least give expressions in the form of dysuria, having problems with urinations. They can be fever, vomiting, abdominal pain, which they can show. And in slightly older children or adolescents, they can obviously complain of dysuria or painful micturations. Along with that, they can be fever and pain abdomen. So these symptoms points towards the urinary tract infections. Now, how to diagnose these urine infections? We explain to the family how to collect urine properly, and that has to be sent to the lab in a very proper way and as early as possible. Now, the most important point to diagnose in urine infection is to look for infections in the urine and also the cultures, which is the most important. Now, if your urine culture shows any bacterial growth, that means that your child is having urinary tract infection and that needs to be treated very early on. Now, whether to admit these children or not depends on the condition of the child, the clinical condition of the child, the bacterial sensitivity. So, if the child is able to take orally, if the child is stable, not too sick, you can treat even with oral antibiotics. But if your child is very sick, not able to take feed, vomiting, so those children needs to be admitted and given IV fluids and IV injections of antibiotics as per the culture sensitivity. So we do not really wait for the cultures to arrive after 72 hours, but any sick children needs to be admitted and early screening of UTI can be done and antibiotics can be started. Beyond that, we look for culture sensitivity. Based on the culture report, we need to change our antibiotics or upgrade it as the need be. Now, remember, children with urinary tract infections, especially in the younger the child is, they are likely to have some kind of anomaly in the urinary tract. So, in that case, it is important that you need to do some various investigations to pick up these anomaly in the urinary tract. For example, the basic investigations you might do is to get a ultrasonography of the kidney and urinary bladder has to be done. Now, if you pick up any abnormality, further test would be required, which will be suggested by the pediatric nephrologist. It is also very important to note many of these children with urinary tract infections has associated comorbidities like constipation, which is really very important. So this thing has to be treated very aggressively. The parent has to be explained about the constipations, the dietary modifications, the lifestyle modifications, and also many a times also medicines has to be given to treat constipation aggressively. Because if we do not treat constipations, they are likely to have recurrence of these urinary tract infections. So overall, these children needs to be diagnosed early and treat early for a better prognosis, and also they needs to be under investigations with other radiological investigations to pick up if they also has any kind of underlying anomaly in the kidney or ureter or bladders. Thank you.